Hey, good morning, everyone, and welcome to UroNurse. It's a nice chilly day out there. Fall has come. Hope everybody had a good, happy Halloween and a happy, what's November 1st? All Saints Day. Welcome to the show. I'm your host, Vic Sinise, and we got a great show for you today. Hey, if you're watching us live, glad to have you on board. We're all over the place live. X, YouTube, Facebook, all of these great places. Also, if this is your first time checking us out, be sure to go to our website at uronurse.com, the best place to find out more information about the show. Also, the best place to watch all of our past episodes. This is episode 118, so there's 117 episodes. Pick your favorite and watch it over and over. Hey, you want to listen to the car? No problemo. Just go to our UroNurse Plus area. You'll find all of our podcasting apps that we're signed up with. Just pick one of those out and you'll be able to go to our podcast area and you'll get it delivered to your box every day. So today I'm really happy to have two great speakers with us today, Dr. Jeffrey Albaugh and Dr. Susanne Quallich, who are both the editors for two different books for SUNA that just got released. So we're going to bring them in right now. And let me go ahead and bring them in here. Welcome to the show. Hey, how everybody doing?
Good. Agree with the chilly morning.
Yeah.
Too.
So I'm going to let you guys, let me swing over to this one here. I'm going to have everybody give a little introduction so people know who you are. For those of you that maybe tuned in for the first time, my name is Vic Sinise. I'm the host and producer of the show. Been involved in urology for over 40 years. And hey, I'm the winner of the President's Trophy this year for great contributions to urology. So that was a great thrill. And I love doing this every week and always enjoy bringing on great speakers like our following one. So let's bring in Jeff here.
Hi, everybody. My name is Jeff Albaugh. I'm board certified urology clinical nurse specialist. And like Vic, I guess we've been around for a while, Vic. So I have been working in urology for over 30 years. And I worked in the private sector. I work at the Jesse Brown VA Medical Center, which is an inner city Chicago VA. And I have been involved with urology patients for long time, as I said, and I'm really thrilled and honored to be a part of the production of this great resource. So I'm excited to talk about that as well. But I'm also a certified sexuality counselor, and at this point, I primarily work at the VA, and then a lot of work with writing and presenting and different research and things like that. Happy to be here. Thanks, Vic.
All right, and go ahead, Susanne.
Okay, I am Susanne Quallich. I am the current editor of the Urologic Nursing Journal, the peer-reviewed journal for SUNA. And I have been involved in urology since 1999. I got to throw that out there. I am also a certified urology nurse practitioner. I am also a certified men's health educator. So my clinical focus at University of Michigan is very men's health oriented, men's urology oriented. Also very excited to be here. Long history of obviously being focused in urology and just really being very invested in the educational aspects of urology too. I want everyone to know what we know. We want you to, I am here to help you take care of urology patients. That's always been a big goal in my career. So very, very happy to be here this morning, Vic.
Yeah, great. Glad to have everybody on board today. So I'm just going to lead off and just say that, Jeff and I were actually talking before the show started and just saying that, how much fun it's been for this career that we've had educating people. It's really a big part. I think that all nurses get involved in patient education, educating each other. I know both of you speak all over the place for conferences and things, but, a lot of it's, in your own practice is just teaching with patients and stuff. And so when we were at the SUNA booth and I was looking at these two new objects that came out, two new books, productions that came out, I'm like, well, we got to have you on to tell us a little bit more about the books, what's involved in them, what's involved in being an editor, because probably a lot of people don't know what that is. And I'm sure you're going to tell us how easy it is. Anybody can do it, right? So I'm going to go ahead and bring Jeff in here first and tell us all about what it was like to be an editor and what was involved in this book and a little bit about the book.
Well, I think Susanne, God knows she could speak to being an editor even more than I can because she edits the journal as well as this. So I will look forward to hearing what she says about being an editor. But it was an exciting opportunity. The core curriculum, the original core came out in 2017, and I had one in each of my clinics because I'm like, everybody has to have the core. It has to be available to the nurses and all of the advanced practice nurses and nurses in my clinics. So I had one in both clinics because I think it's such an important resource to have at your fingertips. And so when Suna approached me and said, would you be interested? We're breaking the core into three different resources. Mine is specifically for adult urology. Would you be interested in doing that? First of all, I was very honored that they asked me to do it. And second of all, I'm just going to be honest, I had no clue what I was getting into. That was almost 3 years ago, and I had no idea how much work it was really going to be. But I, like you, Vic, and like you, Susanne, too, we're committed. We're really committed to education and making sure everybody knows as much as they can evidence-based practice about how to take care of urology patients. We're committed to the patients first and foremost, and we're committed to the people who take care of them. So I said, yeah, let's do it. And Susanne, it's been quite a journey. It's like it's been really interesting, but it's been fun too. It's been a lot of it's a lot of work, but it's been a lot of fun too. For my particular edition, I had 41 different authors that I was working with and trying to help facilitate them, putting out the best work possible. These experts. I have never been a big person in management. I like to take care of my patients and stay in my lane. And so that was very interesting. But I had some wonderful experts step up. I have to say, it's been interesting because some of the original authors came back and worked on it. But like many things, people retired, people moved on, different things had happened. And so I had to find new experts. And that was a fun process and interesting because I got some really cool experts to be involved. Just one example was University of Texas. This whole urology department of physician assistants decided to take on this one chapter, which I thought was so cool. So that was really interesting and fun. I found someone expert out there to talk about polycystic kidney disease that had not really been involved a whole lot with SUNA, but had published things and worked a lot on the nephrology side rather than urology. So it was just very interesting, a really interesting thing to be involved in. And I'm just so proud of it. It's such an important resource. I can't imagine my clinic without this resource, honestly. And then if you want to study, actually, one of my friends from the VA is like, I'm going to take the certification exam and we're going to study a chapter. We're going to go through chapter by chapter and have a study group. And I'm like, yes, I will help you. It's an awesome thing. So anyway, it's an exciting thing to be a part of the core. It was a lot of work, but I can't imagine. I don't even know. I can't believe we didn't have a core curriculum before 2017, but now we do, and we have an updated version of it. It's exciting.
Yeah. Well, I mean, in fairness, you remember way back in the day, the book that, there was that hardcover book that was.
Yes.
Yeah.
Was it called You're
I have it.
Urologic Nursing, right.
It was orange.
Yes. Yeah. I'm sure we both have it somewhere. Yeah. So it's, but this is formalizing it. And I think, having been like previously the certification president, this is such a nice resource for folks, like you indicated, for folks who are looking to certify. And that was part of the motivation really to split it, particularly to offer the associates like their own product, because to really tailor that product, and that product, the associate version of it is tailored towards the certification exam. So I worked actually very closely with the SUNA board, or the SABUNA board, rather, the certification board, to make sure that everything that they were intending to test for the associates is in that resource, is in the associates, the introductory version that I edited. Like you, I think it's a tremendous product. I was very honored to be able to do it. My background is I started off as a certified nursing assistant, like way back in the day. And so for me, in a lot of ways, this was, it was a very nostalgic kind of product. Even though I did not, focus on urology, way back in the day, it was a way for me to provide, in homage really to where I had been to where I am today, to actually be editing a document, a book that relates back to where I started. So I think it's absolutely fabulous. In terms of the whole editorial piece, sometimes I refer to it regularly as a goat rodeo. It can be, it's a huge challenge, and it is, it's up and down. There's days where you're like, oh my gosh, everything's lining up and people actually turn things on time. And then there's the days where you're like, where is everything? Why are we not moving forward? So it can be very frustrating. And sometimes there's like one or two people who are the holdouts. And I think this time a little bit, it was me, because a couple of things, emails from you, I think got past me. So I will own that I think I was one of the last people to get my final edits into you, but it's it's an adventure, but it gives me such joy to have been able to put this together. And and people start talking about, you and I are, and you too, Vic, we're all getting a little older, and this turns into like, what are we leaving? What are we leaving for the people who are coming behind us? And how are we setting our specialty up to keep succeeding after we retire? And I think both of these books are a really good example of, we're providing this framework that will just need to be periodically updated with whatever the new evidence is. So it's been a fun and an exciting project for sure.
Yeah, I think you really hit on something in that there's something with teaching and leaving a legacy. Now, I'm going to give a weird example. I know it has nothing to do with urology, but I started watching this show called The Joy of Painting with Bob Ross. Mm-hmm. Now, if you're familiar with the Bob Ross Joy of Painting, but the guy throws a painting together, an oil-based painting in 30 minutes. Yeah. And he does it with big paintbrushes. I mean, 2-inch paintbrushes and scrapers. And it's just amazing to watch these things come together. And he died, I think, at the age of 50 something of lymphoma, and so he really didn't live a long time. But he put out 30 seasons with 13 episodes of each season. So he put out a big production. So and a lot of times I'll be watching and he says, "Yeah, just go ahead and send an email to me," and I'm like, "Oh yeah, sure, I'm going to go do it." But there's a legacy there. His teaching that other people can still learn by watching it. And that's kind of what I hope with UroNurse does. And I'm sure with the work that you guys have done on both of these books, people are going to remember, oh yeah, this is the book that Jeff worked on. This is the book Susanne worked on. So let me ask you a little bit more about your book, Susanne. This is something that's, what's your focus for this book? Who's it really the best for? And just, why don't you talk a little bit about that?
Yeah. So in developing this and talking with what the SUNA board expectations were for this, it's really designed, like I said, for certified nursing assistants, medical assistants, med techs, LPNs, depending on where their role is. So folks who may not actually have what we consider formal licensure, but who are a hugely integral part of the urology team and our ability to care for patients clinically day to day. And so it is meant to be an introductory text that's easy to digest and really gets them up to speed to what we need when we're looking for someone to assist us with patient care, with procedures, and so on. So it is not nearly as in-depth as the adult core that Jeff has engineered, but it's designed to give you a very good, very solid introduction with that idea of what does it take to function as a colleague in clinic for us when we're taking care of urology patients. So it is more oriented definitely towards the outpatient clinic. But it's designed to just be a resource to get folks up and running as quickly as possible.
We know statistically, most of the offices were staffed by nurses in the past, RNs and LPNs. I made the mistake once of talking about a nursing program and didn't mention LPNs. And I got somebody came up to me and said, we're nurses too, folks, LPNs and RNs. But really that made up the most. But now that's really, that dynamic has changed. Most of the urology offices are staffed only by MAs. And I think that the education component may not be there. I mean, we know that even in nursing, there's really not a urology program that you take it through your nursing training. None of us found out about urology until we went to work in urology. And MAs definitely have nothing to learn about urology or have the ability. So I think a book like this should really be almost essential for every office.
Right. And that's why, we made sure to include in it, a chapter about the equipment that you'll encounter, basic equipment that's necessary to do office cystoscopy, also continence products, also some basic sterilization, safety sort of things. Definitely those things that we know as providers that we, like, I couldn't tell you how to sterilize anything in our clinic. But I'm so confident on our MA's ability to take care of that. And so all of that's incorporated in this particular version of the core.
Yeah. And Jeff, I'm going to bring you in here. So we know that, having a book like this is really essential for anybody who's going to call themselves a professional. We need to have a way to, something to look up. What do you do? Again, there is no urology nursing programs that I'm aware of. You might know of some, but I don't. So tell us a little bit where this can really fit in as something that, I think is essential for all nurses to have that are working in urology.
Well, I think, I think that when you have things going on in the clinic, sometimes you're like, oh, I have a bladder installation today. I haven't done a bladder installation or been involved in that before. And these people are telling me different things. Well, you can look that up. You pull up in the core, just pull up the bladder installation information, and then you have that right at your fingertips. So I think it's really nice to have that information as a resource that you can just go to with whatever's going on. For example, your patient comes in and they have something going on, that you're not familiar with. And so you're like, they have prune belly syndrome or something. And you're like, what is that? And you got the core sitting right there. You can look it up. You can also Google it, but the core has like evidence-based information. Whereas if you Google it, you're going to get all kinds of different things.
Yeah.
You'll get a definition, which will be helpful too. So I use Google in clinic sometimes too. I do think we Google things because it can be helpful, or a search engine. But this really gives you concrete evidence-based information that you can use. If there's a new medication, different things that you're trying to know about or understand that you particularly have not worked with, the information is right there at your fingertips. It was funny when I brought the new core in, I said, look, this is in my office. If you need it, just pop in, take it, whatever. And one of the people was like, give me that. and they grabbed it. And then like an hour later, I'm like, I need that for something. They're like, no, I'm not done yet. I'm like, okay. I just think there's so much information in there.
Yeah.
Even like my friend who was, last night I had dinner with a colleague from the VA who works at Hines Urology. And he was, and I thought that's such a great idea to just pick a chapter, testicular cancer. And that's what we're going to talk about tonight. Like he said, I don't see a ton of testicular cancer in my practice, but I want to understand it. I want to learn more about it. Or like I just said, that you have a family member, how we're the expert for everybody. Your family member's like, I had a nodule, blah, 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 and here's my results. And can you tell me what I should think about this? Again, exactly what I did, because I had that situation arise. I'm like, okay, that is not my complete expertise. Looked it up and was able to allay some of their fears, because their particular things were in the epididymis, and testicular cancer doesn't typically grow in the epididymis. And so we kind of figured out pretty quickly, this is why no one's real alarmed by this of your healthcare team. And so this is how you'll proceed and stuff. It's just such good information at your fingertips.
Well, I'd like to add to that too, just to go back to what you said about the bladder installations too, is that if you're working, hospital systems always have protocols for all this stuff, but if you're working outside of a hospital system or in a newer practice or something like this core is invaluable in developing protocols for your environment. We all know that there's like some very basic, how to insert a catheter stuff in the traditional med-surg nursing texts, but when you're looking for actual, driving development of a protocol or really what you want your staff specifically to do, this is an invaluable resource because it contains all of that information. So for anyone out there who's been charged with updating and developing protocols for wherever you work, this is invaluable.
Definitely. We were excited too because we created a new chapter. It was I have to give a shout out to Kathy Marchese because it was really a little bit of her idea. Yeah. But she was like, what we tried to do with the new core, the adult version, was we tried to take in general med-surg stuff out. The med-surg books are where you want to go for this. This is a urology book. But at the same time, we know that there are medical conditions that greatly impact the genital urinary system. So she was like, well, we could have a chapter on that specifically. And then in the rest of the book, as I was working with authors, I said, we want this to be the core critical information on urology. We want to focus on that and not so much on the other stuff. So we did develop that chapter, and I thought that was kind of cool too. So you can look in there and see, okay, I've got this patient coming in for urodynamics and they have multiple sclerosis. You can look that up and see what might I expect the impact to be on the genital urinary system. You can look up the urodynamics chapter too, but it's just such a great resource. I think it's so vital and critical for everybody to have it at their fingertips. And I realized too, I did purchase 2 of them, one for my clinics last time, and they're not inexpensive. Textbooks are not inexpensive, but it costs a lot of money to create something like these cores. Tens of thousands of dollars that literally Suna, you don't necessarily get that money back, but we created them because people need them. And it's not a moneymaker. It's for sure. I wrote my own book, and trust me, these are not money makers. They take a lot of money, but they're amazing resources and well worth the investment.
Yeah. I think it's one thing that people, get the book and they look at it, they say, holy cow. I think is it $295 or something like that? Did I get it right?
$289 is a non-member price and $229 if you're a member. So $60 savings if you're a member, but yeah.
Yeah. And I was president when the very first one actually was being developed. And, of course, as I had no knowledge of what's involved in publication, it's like, holy crap, when they start telling me what it costs to, set up fees and, all this stuff that was being mentioned. And it's very difficult to you have to sell a lot of books to just break even. And there, as you said, Jeff, you wrote a book, and most people that are authors tell me the same story that have books. They're like, yeah, I do it because I want to, have the book out there for the public, but I've only made a few cents on it. People think we're, unless you're going to write, the Harry Potter stories, you're not going to become wealthy on it.
Yeah. In my book, we just put the money right back in. I never made a penny on any of it. And, and I'm telling you, like my book, for example, I want to say, and I'm not exactly sure, but I think to create the second edition was, like $25,000, which is a lot of money. And the book's $20 a piece. So you don't get the money back. They are labors of love. But this book, gosh, I just can't imagine a clinic running without it. And then too, I have to give a shout out, Suzanne, you were on Kabuna board, and I'm so proud to be certified. I've been certified since 2002. I think it's so important that I can tell my patients I'm board certified in urology, just like my physician colleagues are able to say that. And so I think it's a really, really important thing to be able to do as you work in urology, which where else would you want to work? Urology is the best. That's for sure.
Absolutely. I'm going to bring up a comment that I saw come in. Fran Foley, welcome to the show. She was treasurer at the same time I was president, and she remembers those fun meetings that we had. And I think it's interesting. And the other thing that's people forget about with a book is it's written at a certain time, and it's published for a longer time. And the world of urology, my God, in 40 years, the things that have changed is incredible. So these things have to be updated, and that's why there's a second edition now, just to kind of keep things up to date. I got a question. Neither one of you can decide if you're going to answer it, but for those that are watching that may not be aware, what does it mean to be evidence-based? Because we keep throwing that word out there that, these are evidence-based books, and not everybody, sometimes they have people that aren't involved in nursing that are watching the show because they want to learn more. So who wants to take that question? What is evidence-based? I'll make the choice. Susanne.
Okay. All right. So so evidence-based means that there is some actual science behind whatever it is that you're intending to do or proposing. It's not just, gosh, I don't know. To make some analogies with some of the videos that you have on TikTok, there are a lot of people on TikTok who are like, particularly nutrition video. I watch a lot of nutrition videos on the internet. And there are people who are like, oh, these are, there's no actual products in this, or these are not actually real food, but they don't understand the chemical names, right, of the food, right? If you break down, I think that one of the best videos is this idea that if you break down like what's actually in an apple, chemically it looks like a bunch of garbage, it looks like a bunch of additives, but those are the actual chemical names for the products that that make things up. And so you need some sort of actual science basis for what you're doing. And when you start looking at these things, that's what we want. That's what I want as a patient. And that's certainly what we want for our patients, is we want to be able to say, these are the things that we know work. These are the things that we have some data that things work. And so there's some actual science that's behind these interventions that we do. I think one of the another good example is SUNA did a white paper about 18 months ago now, looking at suprapubic catheters, and the evidence base for what we do with those patients is very, very thin. There's not a lot of good actual science-based papers that talk about what to do with that, but you do have all of these years of experience among urology people and among med-surg people with managing suprapubic catheters. And so there becomes this informal base that doesn't have a science, but based on doing things repetitively over and over with good outcomes, it becomes kind of the standard for what we do. So it's tricky sometimes because, sometimes these things are hard to tease out. We certainly could go down a rabbit hole talking about how people get information and what an evidence-based product really looks like. But in general, like for the core, if we have references for chapters, which we both do, that are from SUNA, are from the American Urologic Association, that are from the Infectious Disease Association, reputable resources, that creates a comfortable evidence base for what we're talking about.
Yeah. We often address the problem sometimes that we see with products and things or practices out there we refer to as dogma on our show.
Yeah.
Because there's just a lot of dogmatic practices. This is how we always did it. And when you start looking at, there's, people out there that are actually doing studies to say how this should be done, you find out that, oh my gosh, there's some really good science out there that says we're doing this wrong. And maybe we need to change our habits and not just rely on 40 years of experience. It counts for something, but sometimes there's, it's not always right.
Right.
So you see that, Jeff?
And then things get updated. So, like I know two simple examples, even while we're working on the core, we're almost done and we're like, oh my gosh, a brand new algorithm came out on BPH and lower urinary tract symptoms. So we've got to pop it in there. So it's like, these are really important, critical things. So one of the highest levels of evidence is from clinical guidelines. And for example, with my adult urology version, chapter 12, the kidney and upper tract urothelial cancers, the guidelines completely changed. We actually had to completely discard the old chapter, the figures, everything, and replace it with everything new. So I think following the evidence is really important. Even when I speak or whatever I'm doing, who cares what I think or what I have to say about it, as much as what does the science say? And then we use our critical thinking. This is how I use the science and this is how I apply it. And that's what's cool about nursing is we take the science and then we go, now how do we incorporate that into your life? How do we take something like a vacuum pump and figure out how you're going to incorporate that into love play with your partner? That's what nursing does. We take the science and we marry it with the patient to help them integrate it into their life. So this book provides the science, and it has some things too, nursing implications and nursing things in there too, to help you navigate that. And I know Suzanne's has a lot of practical information about navigating what you're doing with patients and things like that. So nursing, the unique thing, I was just talking to Urology Times, and they were like, well, what's different about this versus others? This is aimed at nursing. The paradigm is different. We look at patient education, patient advocacy, as well as the science. So we bring those things together to empower our patients to make their own decisions and move through and make the best decisions with urologic issues.
That seems to be a big change too now in nursing and in medicine, is patients being involved in the decisions for their care. And they should be. You know, I think we always assume that, oh, just do what we tell you, we know best, but that's really not the best way to do it. And maybe we don't always know best either. One of the big areas that I've seen so much change in recent years is prostate cancer and the PSA. It used to be, when I started out, elevated PSA, you had a biopsy. You wouldn't even do a second PSA to see if the first test was even correct. It was just automatic biopsy. And how much that has changed. So I think that it's tricky with a book to keep up with things, but as you said, it has to be updated.
Yeah, I think. Yeah, one of the other big updates too is from the last quarter. This quarter was testosterone. When the other quarter came out, we didn't have any oral products at all, and now there are 3 oral pills, which dogmatically, to go back to what your earlier phrase, is that we were always taught you can't possibly give someone oral testosterone because it'll be processed through the liver, it'll create liver cancer. And these 3 new products are very cleverly engineered. And so as technology gets better, our ability to care for patients sometimes more easily gets better. The caveat to that, I always feel compelled to throw this in there, is that we can have like the best intentions, but we all know that there are such barriers sometimes with insurance. I think catheters, just trying to get patients a catheter that they're comfortable with sometimes is a huge challenge because of the barriers that insurance companies put forth. So even though we do have all of these wonderful opportunities to engage with the patients, it can be very, very frustrating for both us as providers and for patients to try and come to that best decision. We're at a cost point that makes sense for an individual.
Yeah, I think navigating things can be really challenging. On the 3rd Thursday of the month, I help co-facilitate a prostate cancer support group at Gilda's Club for Zero prostate cancer. And it's a constant conversation we're having. How do I navigate? It's wonderful we have all these choices with prostate cancer treatment, but how do I navigate my way through it? So, and that's where nurses have a critical role. So advanced practice nurses and nurses and physician assistants all have a critical role, and medical assistants, everybody. We need every player to be informed and give the best care. So that's really the goal of our particular books, is to hit each level and give them what they need to give excellent care.
Yeah. Absolutely. Do have a comment coming in here from Nelsha Glasgow. As an operating room nurse, I find SUNA is not doing enough surgical procedures. They aim mostly at office work. I think that's a good comment to say, and you can talk more about it in the books.
So I love that comment. And Nelsha, please reach out to me. I would love to have your input. This is something we struggle with. We've struggled with since I've been a part of SUNA, both from a certification standpoint, from an editorial standpoint, is that we have challenges trying to find folks who are interested to give us that surgical information. It's been difficult to find folks who are willing to talk about and promote the urology surgical procedures. Certainly for us from providers, we get exposed to that because we need to know that information because we see post-op visits and things like that. But from a nursing standpoint, from a a medical assistant or certified nursing assistant standpoint, you're absolutely right. It has been a difficult area to find people who are willing to share their knowledge and their expertise with us.
Yeah. In fact, 2 different places in the new adult core, we put some of the information on enhanced recovery after surgery, ARIS. And I think there's some real important things that need to go in there in terms of surgery. You'll see that in the later chapters with like continent diversions and things like that, but also in the incontinence chapter, we literally put a whole section on ARIS in there. I do think you're right. I think that the majority of SUNA members work in offices, work in the outpatient setting. And so we can't forget or exclude anybody. And I think sometimes inpatient surgical suite, I think it's really, really important. My clinic, my outpatient clinic at the VA is, of course, there at the hospital where the surgery centers, the ambulatory surgery and the regular surgery centers are all right there. So I think it is really important, and we would love your input, because in 5 or 6 years there'll be another version, and it's going to be electronic. If Susanne and I have anything to say about it, we're going to try and make sure that next one's electronic so it can be updated even more regularly. But I do think you will see surgical things in. I know in my book there's lots of surgical things in there, but I think that focus is not always. We're not always so good at it. So I really appreciate your comment, and apologize that sometimes we're more outpatient focused in what we talk about and what we do.
Well, and I think the 3 of us too can speak to the fact that, over the last minimum of, 20 years, so much of urology has moved outpatient. And so the role for a specialized inpatient urology unit has gone away in most facilities. So some of the feedback, certainly in terms of including these questions back in the day on the certification exam, was that folks didn't have they weren't dedicated urology inpatient nurses anymore. And so it didn't seem it didn't seem like a good return on investment to focus on some of those things, because you just didn't have those focused inpatient urology nurses anymore. And in terms of assisting with OR procedures, I would love to have folks who have insight into what that means in terms of being actually in the operating room, and what the role of the nurse is in assisting with cystectomies, with the endourology procedures, all that. I would publish that in a second if you come to me with that for the journal.
And that would be a really cool electronic thing too, if you think about it. So it could be like a living dynamic document or something. Because I know I have an older publication with SUNA on erectile dysfunction management and things like that. And we were and SUNA's trying to move to more electronic things. And so I think they're open to having something like that, a resource that would be electronic on key information for working in the surgical suite. I think that would be a really cool publication to do, so that people who need it can access it, and especially electronically, because then you don't have to carry around this huge.
Did you have to weigh it? I was going to weigh it before, and then I ran out of time this morning. But
mine's 708 pages long. I don't know.
Size doesn't matter, Jeff. Size doesn't matter.
It does when you have to put that in your luggage or whatever.
Yeah.
So I think that having it electronically. So I think it's a really good idea and resource to have something for people who work in the surgical suite, urology surgery, to have something like that, and to think about an electronic version. And certainly you have the journal editor right here who would be happy to work with you on a publication on that, which would be great. And then that article is something people could download, and it would be a really cool thing. So
yeah. And there is just as another plug for SUNA and the publications that you can purchase. There is a pre-op and post-op series that we did over half a year, about a year and a half ago. And you can actually purchase all of those pre and post-op education articles and we talk about surgery and penile implants and all that good stuff. You can actually purchase that as a separate standalone book as well from SUNA if you go on their website. So we did try, we know that that's a recurring theme, and from the journal standpoint, we did try and address that as best we could. So that's available on the SUNA website as well for anyone who's interested.
Yeah.
See, when you mention things like that, you might end up. When you mention things like that, you might end up with some work.
That's right. Yeah. I remember everyone's name. So.
So Fran put down OR procedures for the treatment of BPH. BPH has almost moved out of the OR completely.
We're true. Yeah, and we did just
minimally invasives.
Right. And it's funny because I Thursday did the like male urology men's health talk for the NPs at Michigan and I have a slide that lists like a bunch of outpatient minimally invasive stuff for prostate. And I'm like, here's some things. Don't fret about it. Like, these are going to change by this time next year. Like, don't waste any time trying to memorize these. And we did also just publish a nice piece about the inpatient management for aquablation. An old colleague of mine came to me with that as an idea, and I'm like, yes, please, because we don't know anything about it, and the company itself didn't have a lot of real helpful information. So that is now the only document out there, that we have, and so SUNA, we've been able to get to the forefront in terms of that in nursing care for men who undergo the aquablation procedure.
And even
I think that we need to remember that. Excuse me, Jeff. We need to remember how important the journal is too for keeping articles that are more up to date. Get that information in. If you want to see something, know somebody that can talk about it, connect with Susanne. She's the one to do that. I got a couple quick comments I'm going to bring up here. Nelsha says she did purchase the book at the conference. Good going. And mentioned to the education department at the conference that a proctored exam will be amazing.
So, I can address that. We used to do that at the conference, but since the test has gone online, you can do it locally. And so the thinking was not to take up people's time at the conference, and to allow them to network and to hear the new things that the conference presents. So you can actually do the test close to home, which most people I think find way more convenient, and then can take full advantage of the SUNA conference.
Yeah. Got a few more comments coming in here, so just like let people get their comments out. Doing a lot of prostate biopsies in the OR. That's the perineal biopsies that have really becoming more and more.
No, very rarely. I mean, I can't speak for your experience, Jeff, but very rarely do we do any prostate biopsies in the OR. It's not cost effective, and unless someone has some anatomic issues or such significant, we'll say, anxiety that they can't tolerate even, kind of low grade sedation in clinic, we very rarely do them in the OR. So
I think you may be referring to the transperineal approach.
No, we do transperineal. All. Yep. Yeah. All. Yeah.
At our VA, we have our procedure rooms and stuff, but the OR staff, we have OR staff who they work in our procedure rooms and do all that. So they go back and forth between the surgery suites, and they also they rotate into the urology clinic where we do a lot of the procedures and stuff like that. So I don't know. I know in our clinic we do, it depends right now, because that area is having some construction work and stuff. A lot of the stuff is being done over in the OR. So I think that can happen sometimes. And we do share staff because it's interesting, but because of how our VA is set up, they do work in our procedure room. It is OR staff people who work there. So maybe, I don't know how it works in her particular facility, but that may be why too.
I have another comment came in from Katie Wall. If we can get operating room nurses involved, we should definitely include surgical technicians also, especially since a lot of urology surgeries are in the surgery centers or in the office operating rooms. Exactly.
Yeah. Such a good point.
That one.
Yeah.
Katie
Yeah,
is
and
one of the
Nelson
authors.
did come back and say that she was referring to the transperineals. I
Um,
know Lori Atkinson, one of our experts that's on most weeks, was saying that their group does all their transperineal in the OR still.
Wow, that's surprising, because just from a staffing and from a facility fee utilization time standpoint, that doesn't seem to be the most cost effective way to do it. You know, we do, like I said, we do almost all of ours in outpatient clinic room, in a procedure room. So interesting. It's just interesting. People have different, again, dogma. We're talking maybe.
It could be. Katie said it may be a variable based on regions and insurance coverage for in office ORs versus surgery centers versus hospital. It could be an insurance, you know, and we're looking at a global audience, so it varies
Right.
depending on where you
Right.
practice. So
Right.
and offices are all different. I have the luxury of having our own OR suite in our particular office, so
Wow.
we can get anesthesia in there and
Oh, wow.
do just about everything in there. But some offices are smaller and don't have that ability, so they're just doing under local. So it is a big difference.
And Katie, by the way, is the co-author on that chapter on medical conditions and that affect genital urinary system. So thank you, Katie, for working on that chapter.
Yeah. Hey, thanks for all the comments that came in. We woke up our comment groups here, so that was great. I wanted to ask you a little bit about, you know, what it's like to try to get people. You mentioned wrestling in goats, Susanne, about, and I'm assuming goat means greatest of all time. You were getting all the no, you were just talking about goats, right?
That's goats.
So what's it like to try to get people? I mean, I know personally what it's like to get people to come on the show, and it's sometimes, you know, it could be easy. I'll just say, hey, listen, you guys, you need to do this. But other times it's a lot of work. So talk a little bit about what was involved in your book.
Well, my book was me, so it was real easy. Like, I only had to yell at myself if I was missing a deadline. But you know, but in general, you know, having done, you know, like Jeff, having done other books in the past, you have to, you need to be a person who can keep track of things. And I never give everybody the actual deadline. And you probably learned this too, Jeff. You know, if I want your thing by July 1st, I'm telling you your deadline's like April 30th, because I know life happens. I know stuff happens. People forget, you know, they get different work responsibilities. So there's always a padding component. You know, like if you're familiar with Star Trek, it's the opposite, right? The engineer was always like, oh, this should take 8 weeks. And then he was like, but I'll get it to you in 2 weeks.
Right.
It's the opposite. You know, it's like, I need this, you know, in 8 weeks, but I'm going to tell you the deadline is 2 weeks. So there's some of that. And it just, right. And I think in tables anyway. And so I always have tables and deadlines and columns, and that's really how I personally keep track of everything. But you know, life happens, and you have to sometimes meet people a little bit where they are. Also, you have a lot of mostly returning authors or people who are experienced. Sometimes I also love to encourage new authors. I'm always looking for new authors, and those folks sometimes need a little bit more coaching, and so you have to build in time for that, because I want you to create a product that you're proud of. So it depends. It just, you know, it's kind of all over the place, but the organization piece ultimately is what underpins everything.
And Jeff, how about you? A lot of trouble wrestling those goats?
There could be. There were challenges with some people and stuff. And then, you know, as an editor, I mean, honestly, with the deadlines, sometimes I just have to jump in and finish it, you know, and then give it back to the author and say, it's done. I really couldn't wait any longer for you to update this particular guideline in it. So it just depends. But most of the people were wonderful, and it was fine. But it is challenging, and I would definitely say that there are a few people that would say that I stalked them, because I find you. It's like I do everything short of showing up on your doorstep, because I really need what I need from you, and I don't have any choice about it. But I had a lot of really good people that came through. You know, like Dr. Quallich, her chapter is great. And and so there's a lot of really wonderful professional people. And it was fun to work with when I did have to find newer people. It was challenging, but it was also fun to get somebody brand new to work on that particular chapter because the other author had retired or was unavailable. So that was really interesting too. And all of it, the peer reviews, again, you're chasing after people. Where's my review? What's going on? But so many people contributed to this. I really appreciate that because we've got, like I said, the 41 authors, and then I guess I was an author too, so 42. And then also we have, like besides those authors who were peer reviewers for some other chapters, there were, like 20 some odd peer reviewers in addition to, sometimes an author would peer review another chapter, but all the chapters were peer reviewed as well. And, but that's what makes it a good evidence-based, reliable resource. And so it all works. It was challenging, but wonderful. So
yeah, I find it rewarding.
Would you do it again, both of you? Would you do it again, Susanne?
Well, I find that I'm an excellent author, so I would work with myself again. But I think it's. I would tentatively say yes, but who knows where any of us are going to be 5 years from now?
Yeah.
I was about to say one of the things that I enjoy about working with folks is that you get to know people in a different capacity. Like you could see, you may see somebody speak and they do this wonderful job and they're a very confident speaker. And then you find out that they're very, very nervous about putting those ideas on paper, so you see a different side of people. And I enjoy that and just coaching them. Would I do it again? I don't, we'll see. It also goes to the idea, but to be honest, Vic, some of it goes to the idea too of, Jeff and I have been around for a long time, and it is always good to bring the next people forward, so I would be certainly willing to co-edit with someone else and kind of bring them forward and with the idea that they would, passing the baton.
I think for all of us, that's true that we need to be mentoring the next generations because we don't want to
work forever.
just like my authors, when I'd go to find them and then I'd go to find a replacement. I've been around SUNA a long time and they're like, well, I retired too. And you're just like, this is really good. But it's challenging, but it's fun because then you get other people to step up. So I think that's really important for us to be mentoring and looking at our next leaders, our next people to take over some of these things. Definitely.
Absolutely. Katie Wall said, thanks, Jeff and Kathy, for inviting me to help with the chapter. It's always a learning experience and great opportunity in writing for a textbook for the first time. See, there you go. Mentoring, as you said, it's bringing people along. It's tricky to get people to kind of sometimes open up and be willing to put the work forward. But I think once you inspire them enough and give enough nudge, that all of a sudden you find out that, maybe you can't shut them up sometimes. They're just really.
Well, and I have never had anyone come back to me and be like, I hated seeing my name in print. I really hated it.
Yeah.
No one says that. Once you get that finished product in front of you, everyone's very proud of it.
Mm-hmm.
It's almost like your kids, Sometimes you hate them for a while, but you always love them at the end. Especially those teen years.
Well, and this was, I guess, Susanne, I don't know how you felt about it, but yeah, it was pretty. There were times where it felt like it might be painful, like giving birth to a child or something. But it had its, or giving birth to a kidney stone or whatever. But it was, but a lot of good things too. Just like. It's a good analogy, Vic.
Yeah. Well, I think this has really been a great discussion. I think that obviously we learned a few things from our audience too. I think there's a need out there for more. There probably should be something more surgical focused, especially with all this inpatient, in office stuff that's being done now that we've moved out of the OR for, so many things. Really the big things we do that are in the OR in the hospital are, the radical prostatectomies, which robotically are out at the next day sometimes, cystectomies, things like that. And they're small numbers. The bulk of what we're doing now is outpatient. Really need to have something concentrated. And I think, Jeff, as you'd mentioned, we need to make this electronic so that it can be,
Yeah.
more easily updated and kept up with. Imagine, a book like either one of the books that you wrote going through an AI system where you could now just chat GPT the answer and having evidence-based answers coming up. That's the future.
Mhm.
It's really going to make a big difference, I think. So I don't see any other comments coming from the group. Any last things that either one of you need to get off your shoulders or talk about?
I would just say myself, SUNA has been, I was saying to Kathy and I were talking the other day, and I was saying, I can't even imagine my urology career without SUNA. And no, and this is just a free endorsement. And I just say that because I just can't imagine the group of friends, the network of people.
Yeah.
And I can say since I started in the 1990s, I went to every conference every year, and I always learn something. So it's a wonderful network of people. It's a wonderful resource. So take advantage of it. There's always things to be done. It's been a wonderful opportunity for me to be a part of SUNA, and it's blessed me in so many ways. And Fran and I go way back. We've had a lot of fun together over the years, for sure. We plan conferences together and all kinds of things. And all my colleagues, it's so fun to see everybody every year, but also just to keep learning new things. And so I think it's great. SUNA has a lot of wonderful resources, and I hope that everybody takes advantage of that, as well as this. Vic, it's a spinoff from SUNA that he's done all this great stuff to educate people.
Absolutely. Yeah, I would just like to second that. I fell into urology by accident and loved it. Like, you think urology is just about catheters, like whatever, how hard can it be? But I fell into it, and then I was looking around. I was like, where are the other urology people? And eventually found SUNA and was like, these are my people. These are the folks who have the same shared passion for all of the urology stuff that we're doing. All of the funny comments, all of the off-color comments, all of that, and just clearly never left. And have networked, and really proud to be able to call Jeff a friend and a colleague, and everything. It's been a tremendous organization through the course of my career as well.
Definitely,
absolutely. So yeah, I of course I agree with all of this above statement. It's been involved in my life for all this time too. It's really a great organization. It's been able to really, where I learned everything that I know. And again, it's not out there. You're not going to find urology in any of your formal training. So you need to go and find an organization similar to SUNA, or of course you got SUNA always to see. So with that, I'm going to put a little promotion in for next week's show.
Simple Cath is the only FDA-approved female catheterization assisting device on the market that assists healthcare professionals with urethral catheterization of female patients. It was developed by a board-certified urologist, Dr. Filoni, who watched for years as nurses struggled using catheter kits designed for men on women. Healthcare workers frequently have trouble finding the urethral opening and accidentally contaminate the catheter by placing it into the vagina. It is no wonder that patients who require a catheter to empty their own bladders also frequently struggle to catheterize. Learn more about Simple Cath on uronurse.com November 9th at 9 a.m. Central Time.
Yeah, so join us next week. This Dr. Filoni came up with this kind of unique invention to help make it easier to catheterize female patients. And I think it's going to be a neat one to check out. One of my big joys of UroNurse has been finding these little products that don't have big sales companies to go into the offices and tell you about them. And there's some really neat products out there. So be sure to join us. A couple last comments that came in. Charlene Valmer said, well said. And Nelsha Glasgow, great discussion. I enjoyed it. I'm looking forward to the updates. I'm outside of the US, so getting involved is a bit difficult. Even taking the exam, I have to travel. I love urology. And yeah, well said. I mean, that's one of the things I found out is this program goes to, I think last time I looked, it's 46 countries that are watching UroNurse at some time or another. So Yep. Don't know. We talk a lot from the U.S. because that's where we're from, but we know there's a lot of folks that are watching it from everywhere else. So
Congratulations.
yeah, thanks. So with
Yeah.
that, thanks again for joining me. This great discussion. It's been a blast. Who could ever think that you could do something without slides? This is the first true interview one I've ever done. And I really had a blast doing it. I'd love to do it again sometime. So might be calling you sooner than later. All right, everybody have a great rest of your weekend. And we'll see you all next week.